Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello, and welcome to Research Perch. I am Dr. Sarah Fogarty, Associate Editor of the International Journal of Therapeutic Massage and Bodywork. The IJTMB is peer-reviewed, indexed in PubMed Central, and free for all readers. It is the official journal of the Massage Therapy Foundation and the Registered Massage Therapists Association of British Columbia. Today, I'm here with Dr. Cynthia Price to discuss an upcoming special issue of the journal coming out in September 2025, which is a special issue about massage therapy and mental health. I'll let Cynthia introduce herself. Not that she needs an introduction, everybody should know who she is.
I don't know about that. But anyway, thank you. I'm Cynthia Price, and I live in Seattle, Washington, and have been a research professor at the University of Washington in the School of Nursing and a massage therapist by training. I was in practice for a couple decades and then did research for a couple decades in involving touch-based interventions for mental health. And joined Sarah and on this special issue. So we're excited that it's about to come out. And yeah, Sarah, do you want us to tell us a little bit about the idea for this?
Sure. So as editors, we had a discussion and I raised the idea of a potential special edition. So there's lots of lovely reasons for a special edition, one of which is that it condenses information for people that are interested. In one edition, it tends to get more readers, which is great for everyone, for our industry, for people wanting massage and those in other allied / health professions that want to read about what it is that massage and other body work can do. So we talked about it. We decided on mental health because it's such an important, we thought it was such an important area, but it was also broad so that we weren't limiting the I guess scope of the special edition, because we did actually want to make sure we had some articles to publish within there. So we set it up. It took a long time. We got you on board as an editor, which was amazing. And then we put it out there and we ended up with about 11 submissions, which was fantastic. And then we ended up with 8 and an editorial in our final lot, which is coming out in September. And we've got this really lovely mix of different types of articles. So we've got some case studies, which I always think is really interesting, so that people can see what is working and what people are doing in the industry with mental health. We have a couple of reviews. We've got a commentary piece. So there's lots of different articles and around different topics. So that's the joy of that broadness of mental health. We've got some on PTSD. We've got some on wellness and mental health for those that are seriously ill. We have some somatic. We have a framework about somatic relational work for mental health and healing, which is lovely. So there's this really nice mix. There's some trauma stuff in there. So there's this really lovely mix of all different ways that massage and body work are being used in practice and the way that we think about it.
Yeah, it is a nice diversity of articles. And one of the things that when Sarah mentioned we were sort of, hoping we'd get enough folks to submit is there really hasn't been a lot of research focused on mental health and massage. Almost surprisingly, really, I think, overall, I would say, over the past 15, 20 years. And I think one of the things that is, I think kind of comes through with the entire edition is, as we know, with whether we're thinking about physical health concerns or mental health concerns, oftentimes, they blend, and mental health is in there, right? We know that chronic pain is a biopsychosocial
Yeah.
experience. We know that even the worried well, when they're often coming in for body work, the stress component, anxiety component that massage therapists are dealing with is highly, highly prevalent. And so just thinking about how much, I think there's often some tentativeness about thinking about really targeting mental health with massage, like it's out of our scope of practice, or those kinds of concerns come up, when in
Yep.
reality, right, it's part of what comes into the room all so frequently in so many ways. And although that may not have been directly touched on in some of these articles, I think the overall scope of what is presented across these articles does kind of touch on that.
I
Yeah.
agree. And I feel like it's that holistic, that the care was holistic and it included how people were feeling and what was going on in their life. And while it wasn't in the majority of cases, I think very specifically targeted to relieve a specific mental health symptom or to deal with a particular condition, it was that overall mental health and well-being of someone. And that does absolutely come through in the articles, that massage has this lovely duality of being able to work with tight muscles and different types of pain, but also, as you say, the stress, the anxiety, the well-being of people, which absolutely includes their mental health.
Yes. Yeah, and even though there's some articles that are focused on trauma, for example, that we've got a review article, we've got some others. I don't know, something you said sort of made me think of this, is that, and also the work that I've been involved in over the years is oftentimes that it really is more of a holistic perspective on the person, just because that's what massage therapy is, right? And so it's not so much that we're targeting one specific mental health condition, it's more we're targeting the well-being of that person in all the ways that it may show up in their bodies, in their presentation, and how they're trying to live a more healthy life for themselves, right? So, yeah, I think that's a really important thing for people to have as a background perspective with mental health
Yes.
massage.
Yep. And are you happy to share, Cynthia, a little bit? We wrote an editorial and we talked about that when we were considering the editorial, about what is required and what sort of we need to be able to have in our skill sets to be able to work with mental health. And I think that's a really interesting thing that is, again, not really stated in these articles, but is very, is just sort of obvious, that these therapists have a particular skill set that isn't perhaps always taught and isn't often taught necessarily in courses or in our education around how we can help support people with mental health, and how we can, as therapists, make sure that we do that safely and with care and in a trauma-informed way.
Right. Yeah. Yeah, we touched on this because, Sarah, and I think it's so important, but not only
Yeah.
that, I think like you're saying, throughout these articles, when people were talking about how did they interact with their clients, both at the very beginning of the session and throughout the time on the table and at the end of the session, it did come through that there was this awareness of the arc of a session, and that having that conversation with someone at the beginning to talk about how are you doing, what are you here for, how are you feeling, how can we create a session that works for you so that you're comfortable and feel safe, those kinds of things, which don't have to take a lot of time, but it's really important to do, to kind of help set the stage for someone to feel like they have a voice in how the session goes, and that there is this back and forth with the massage therapist that is modeled in that moment, right, of the intake. And I just think that's so important, and really does dovetail with this concept of what is trauma-informed care, which is really around the level of respect and also the control in the client's sort of perspective of how the session goes, and having things doing a lot of check-ins over the course of a session. You know, are you doing okay? Is this the right amount of pressure? Do you need to get up and go to the bathroom? Do you need anything else? Are you okay if I touch here, if I don't touch here? You know, just all those kinds of verbal interactions that help make someone feel so much more comfortable and so much more in a position to say, you know, actually, no, I need to not have that part of my body worked on, or that is too much pressure, or whatever it is, which sounds so fundamental and simple, but they actually have an enormous impact on someone's experience. Yeah.
And just the way that people ask them so there is choice and voice is such a big thing, and creating that level of trust so that people can feel safe to go, actually, no, it's not. I think just because you ask the question doesn't always mean that people feel comfortable to give the answer. And the way that we ask is often can help determine that. So a more open-ended question, like, how is this pressure for you today, is going to potentially elicit a more a response across the spectrum, as opposed to, is this pressure okay? Where people might feel they need to go, yes, it is, it's fine. All of those skills are so small and so important in allowing people, as you said, to feel like they have choice and voice, and that the therapist can meet them where they are at that moment in that session. Which is it's such a lovely thing. And it does come up a little bit in the case studies, probably a little bit more than the other articles, around how the therapists potentially created that, and also how they, I think, were comfortable to sit in that, because it's one thing to create that space, it's another thing to then hear some things that you might not be comfortable with. So I think that's the other thing too, is that it's not just how therapists manage to create that space, but that they are skilled and tooled and feel like they're resourced to be able to hear whatever might come when you create a safe space for someone to share. So
no, that's absolutely true. And this idea of how does one do that and not feel like they're, you know, in a psychotherapeutic mode, and it's more having the present skills and the comfort skills with materials, so that one can listen, but not necessarily feel like you have to do anything with that in other than acknowledge what you've heard, right? And support the person in the moment with whatever emotionally may be going on for them. So yeah, and I think, you know, we have such a variety of training programs that are out there, and some do a really lovely job of helping clinicians to learn some of these skills, and some that could really use more bolstering of these skills. And so I think, again, this is something from an educational level that I think we'd all like to see in the initial training, but making sure there are ways and places people can go for continuing education to bolster those skills, because they are so helpful in therapeutic interaction.
And they're really lifelong learning skills, aren't they? That, you know, it's not something, I think, that is necessarily mastered, that you don't learn it and go, I've got it. I've got the listening bit down pat, and I've got the bit where I'm okay to sit and just listen and try not to jump in, which sounds easier, much easier than it actually is. Particularly often, I think, for massage therapists who want to help. Like, that's part of, you know, the big ethos of massage therapists, is that they have this lovely desire to help people. And so it can be quite hard to just sit and listen and not try and fill that space with something or suggestions on, have you tried this? Have you done this? What about this? So I think it's, that having that mix of having it embedded in some early training so that people can start to be aware of it, to start to develop those skills, and then have it also as continuing education so that people can continue to build on it, because it is I think it's a lifelong skill that we get hopefully better at, but we will all have days where we have limited resources, or where we, might not know about something, and then, and I think that,
like working with clients, there's always something new that might come in the room, right? That you've never heard before or been exposed to before, right? Yeah.
Yeah, whether it's an injury or whether it's a situation or an experience or something you've never, as you say, you've never heard before. So it's sort of lovely, I think, to have a special edition to be able to create this sort of conversation and hopefully make therapists aware. I mean, I feel like every person that submitted an article is aware of that, as you said, and it's very subtly sort of scattered through the articles in a way that perhaps might not be obvious on a first read. So I think sometimes it's good to read the articles and then read them again and sort of try and work out what is perhaps being stated not quite so clearly. So
yeah. Yeah, I do. I think having this framework for thinking about them just is helpful, right? Hopefully, this kind of perspective will come through as people do read these articles. Yeah. You know, we're thrilled that this is coming out, and we hope, one of the things, sort of piggybacking on the April conference that the massage therapy put on, there was quite a lot of interest in the topic of mental health. And so I think the level of interest in the room on that was sort of exciting to me in relationship to this issue coming out. And so timing wise, I think it's well timed. We'll just put it that way.
serendipitous.
Yeah, and I think one of the things that I see a lot working more in the psych realm actually is there's a lot of crossover happening right now with people who are mental health professionals really focusing more on the body, and people who have the somatic skills who are really going, I need to know and feel more comfortable working in this realm with sort of emotional and just overall well-being perspective. So it's I think we're in an interesting crossroads with across disciplines with sort of the continuing education piece of this for the mind-body sort of connection. And yeah, I think that's a pretty exciting place to be personally, but
I do too. I think massage has this lovely thing to offer that, as Pam Fitch often talks, that, those talking hands, listening body, talking hands, that capacity for amazing things to happen in the right environment without talk therapy per se, but those hands can pick up some really lovely things. And it's also within, the control of the client. So the client gets to experience whatever they're experiencing. And I think it often is that intertwining of mental health, emotional well-being, physical well-being, which is such a lovely thing. And I think it's one of the strengths of massage is that it has that capacity to work on well-being and health overall, not just a tight muscle or a sore leg or a sore back.
Right. It's a very integrative modality. Absolutely. And it is one of the most beautiful aspects of doing this work. I would agree. Yeah, so we hope you enjoy reading this issue, and I don't know about you, Sarah, but I feel like if people want to contact us, if they have any additional kind of thoughts or feelings, I don't know whether there's ever been like a comment section, like letters to the editor in these
You
journals.
you can absolutely write letters to the editor, and sometimes you can just write them to share with us, and sometimes you can write them for the purpose of being published. I'm pretty sure there was a response to an article that came out for IJTMB for one of the articles that was published. But you can absolutely contact us, either for something that you would like to have published around the article, or for just contact us to talk to us without worrying that anything's going to be published.
Great. Yeah, because I do think, having ongoing discourse around some of these, these ideas is really important, and the journal could serve that purpose potentially, right? Yeah. So hope to hear from you, and we hope you enjoy reading it.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.